Welcome to Group 3's presentation for the Rationale for Interprofessional Collaboration in Canada. We'll start off the presentation by going over the learning objectives. First, we will define interprofessional collaboration, or IPC. Next, we'll identify what we believe the rationale for IPC in Canada to be. As you can imagine, the rationale is multidimensional, so we have focused on what we believe has the most significant impact on quality patient care. Finally, we will tie it all together and offer suggestions on what we see as important next steps to further IPC in Canada. The World Health Organization defines IPC as multiple health workers from different professional backgrounds working together with patients, families, carers, and communities to deliver the highest quality of care. Our group believes that interprofessional collaboration is the foundation for quality care, and it has the greatest impact on the way in which patient care is managed and transferred in Canada. Patients within Canada's healthcare system stand to benefit the most from interprofessional collaboration. The following slides will highlight the rationales for IPC in Canada. Interprofessional collaboration is key to managing and transferring the care of a patient. One significant reason our system depends on this collaborative approach is because professional specialization is on the rise. This is due to the expansion of knowledge and skills required to manage the many chronic and complex health conditions that exist in today's world. In other words, one patient may have multiple care providers for one or many health conditions. Oftentimes, it is one professional who would refer the patient to another. This is why role clarification is so important in collaborative healthcare. Identified as one of the 6 competency domains in the Canadian Interprofessional Competency Framework, role clarification is more than simply task shifting and delegation. It is a true understanding and appreciation of the roles and responsibilities of both one's own profession and the professions of others. All of this is an effort to jointly create and adapt care plans to meet the diverse needs of patients. Although referring a patient to another professional sounds simple, it actually isn't. Interprofessional collaboration is a skill that must be learned. So the question is, how? The World Health Organization states that interprofessional education, or IPE for short, occurs when students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. To achieve a collaborative, team-based environment, IPC must be taught and promoted to healthcare students. Prompted by nearly 50 years of inquiry indicating that effective IPE enables effective collaborative practice, the WHO disseminated a study highlighting both the current global status of IPE and IPC, and also the important next steps policymakers can take within their local health system. The study found that Canada had already made recommendations for IPE to promote team-based working in the Rationale Commission, and the government of British Columbia had passed legislation in 2008 that included a provision on interprofessional collaboration. It also highlighted the emergence of Canada's National Health Sciences Students Association in 2005. To date, this association remains the strongest link to the Canadian health and human services students. While great strides have been made to advance IPE, there is strong indication that IPE enhances patient outcomes. More studies are needed to make generalizable conclusions about IPE and its effectiveness. This is certainly an opportunity for further research, because exposure to different professionals and approaches to care management have the potential to yield a more educated and informed patient, another significant reason for IPC in Canada. Patients benefit from an interprofessional approach because they have increased exposure to professionals in fields that they had not been aware of before. By sharing the patient's healthcare information with not only their primary care physician, patients are able to receive the best care when they need it most. A study by Goldman and others looked at a small family health practice in Ontario and showed that patients were accepting to receive regular care not just from a physician, but were open to nurse practitioners and others. The study did find education of patients would be key to the interprofessional approach, as many would not be aware of other healthcare providers' roles as the traditional family doctor approach is what most people are familiar and comfortable with. The ethical principle of autonomy recognizes the right of a patient's self-determination. This is an often forgotten principle in healthcare, as traditionally, physicians have had a paternalistic approach in providing care to their patients. That is, they limit their patient's autonomy by doing what is best for the patient, rather than considering what is important to the patient. Interprofessional collaboration helps patients have their autonomy respected by providing them with increased knowledge regarding their health and allows them to make informed decisions about their care. Many studies, such as one completed by Suchman and Associates, have shown that if patients' autonomy is supported by their healthcare providers, and if patients are educated about their healthcare options, the patient is more motivated to participate in their healthcare decisions and tend to make the recommended behavior change and maintain a positive healthcare status. This open communication model between all parties makes everyone feel like they are being included in the thinking process regarding the decision. IPC is not possible without effective communication. Effective communication is crucial to optimal patient outcomes, and poor communication can lead to patient harm. High quality and safe care depends on the ability of healthcare providers to communicate well with patients and with other professionals. Due to this nature, IPC has spurred on the creation of more effective forms of communication. This is especially necessary when professionals exist in different care settings and is particularly true in patients in remote or rural communities where travel is required to receive healthcare. To overcome this barrier to effective interprofessional communication, a common, accessible patient record in collaborative care is required to enable communication between physicians and other healthcare professionals. To provide the safest and finest care, EHRs, or electronic health records, can be used as a logical tool in IPC to maximize the quality of healthcare. Additionally, tracking and reporting in healthcare within IPCs is easier with EHRs. The next slide will briefly discuss EHRs as facilitators of IPC. Electronic records improve communication between healthcare professionals. For instance, it provides speedy access to patient information, enabling real-time communication about patients when the physician responds to phone inquiries from other clinicians. Moreover, it improves interpersonal communication between professionals, as EHRs foster the feeling that the patient information is shared for teaching and management purposes. EHRs can store and retrieve the data, which leads to improved quality of care for the patients. They also consolidate patient information such as diagnosis, medications, and test results, which enables IPC to provide safer care services. EHRs aid in decision-making amongst IPC. For instance, in problems when tests are due and when particular care does not meet guidelines. Tracking and follow-up can mark irregular test results and stored information about the patient's signs and symptoms. Maximizing interprofessional communication between professionals enhances healthcare and makes managing and transferring patient care more efficient. When working on an interdisciplinary team, healthcare professionals spend less time trying to diagnose complex issues affecting their patients, outsourcing difficult problems to team members that may be better qualified to address said issue. This type of collaboration can speed up the delivery of care. A faster diagnosis will mean work can begin on a solution sooner rather than later. This in turn means that if the patient will receive the appropriate care sooner than if a single healthcare professional were to attempt to resolve the issue solo. Often, a patient can bring many complex issues to the table. These issues are usually broad in scope and can be a lot for a single professional to handle. When on a team, the issues of the patient can be delegated to the most qualified team members. This support system can make it much easier for healthcare professionals to manage their patient, knowing that issues that fall beyond their scope of practice are in good hands. A rudimentary metaphor for this effect can be seen in how a single person cannot lift a car, but a team of 10 people can easily get all 4 wheels off the ground. While working on a team, other healthcare professionals can help expose individual team members to other occupations with different scopes of practice. Professionals accumulate knowledge from witnessing others on the team approach, diagnose, and resolve issues in ways that are different from their own. This broadens the understanding of each individual professional, allowing them to recognize diverse patient ailments and point them in the direction more quickly. There can be issues that negatively affect the efficiency of healthcare when professionals work on a team. In collaborative efforts, professional roles need to be clearly defined and respected. Every team member needs to know what the other team member's strengths are and needs to understand the importance of each role. Where a single team member believes their expertise are more valuable and encompassing than one or more other professionals on their team, it can result in the lone wolf effect. As a result, they will slow the effectiveness of their team by making more work than they should and ignoring those more qualified on their team. Another mistake that can be made when collaborating between professions is overlooking the importance of an organizational process. Simply assigning an issue to individual team members is not enough. There needs to be a communicated resolution and an acknowledged accountability for each issue addressed. The entire team needs to know what is going on and be on the same page in terms of who's dealing with which problem. Failure to establish an organizational system can result in more than one professional addressing the same issue, a problem known as redundancy. Due to the many variables that exist throughout the care of a patient, the development of a successful interprofessional module is essential yet challenging at the same time. An unsuccessful collaboration could result in a less than desirable care for the patient, delayed results, and worst of all, an incorrect diagnosis. In an effort to ensure that these mishaps do not happen and are kept to the minimum, good communication is essential within the interprofessional team. Good communication amongst all team members can help alleviate redundancies that allow the patient to have a better experience while under care of a hospital. Some examples of redundant care include the unnecessary questioning of patient history repeatedly, unwanted disruption during a patient's stay or care at the hospital, as well as repetition and the reordering of protocol tests during the same visit that can cause discomfort and also prolong the patient's wait time for results. Unnecessary wait times for results is not only time wasting for the patient, but also for the laboratory personnel, nurses, doctors, and other members of the healthcare team. The patient's stay at the hospital is unnecessarily prolonged, which in turn decreases the amount of available bed space that could otherwise be directed towards other patients who are in need. Running unnecessary tests because of lack of effective communication, as well as the hoarding of bed space due to extended turnaround times for results, can cause the hospital unwanted strain on both the laboratory's resources and the hospital's budget and reputation. It is very important to remember and be aware that the patients are customers of the service the hospital provides. They should be treated with respect and compassion during their stays so that they feel included in any decision-making processes. This can help empower the patient to stay positive and feel confident in their healthcare team that they are getting the best care during their time of need. It is vital to highlight the difference between proper attention and duplicated or redundant attention. Proper attention could be described as providing the patient with the necessary care and help during their time in hospital, such as running the appropriate tests in a timely manner and providing the patient with information to clarify any questions they might have regarding their care. Duplicate or redundant attention could stem from a failure to understand the process and principles for working together. When one is unsure of their role or duties in the interprofessional team, unneeded attention is given to the wrong areas. Role clarification, as discussed earlier, can help with this. As health professionals become more immersed in their work environment, they are more likely to gain a better and more comprehensive understanding of their own identity and their respective interprofessional team. It is important to be an active member of the team by actively collaborating with others and listening to constructive criticism. These are useful qualities that are not only beneficial to the members of the team themselves, but also to the patient. The awareness and pursuit of reducing redundant care is important for patient safety and also improving quality of care. In summary, our group believes that these are the next steps that need to be taken for IPC to be more effective in Canada. They include increased education of healthcare professionals starting in post-secondary regarding interprofessional collaboration, increased education of patients regarding other healthcare providers and options, and finally, a standardized method of evaluation of the effectiveness of interprofessional collaboration amongst all professions. Thank you very much for taking the time to view this presentation. If you have any questions, we'd be happy to discuss them with you in the discussion board posting on Blackboard. Thank you very much.